Hello, good evening. This is Jeff Irwin, State Senator from the 18th District in Washtenaw County. I'm very pleased to be joined by my good friend, County Commissioner Katie Scott. I'm really delighted that she was willing to join me tonight in giving an update as much as we could about what's happening with coronavirus here in Washtenaw County, a little bit from the state level, a little bit from the local level, and hopefully answer some of your questions. Katie Scott is a county commissioner and a registered nurse, but I want to ask you to introduce yourself just a little bit, even though, I've already sort of introduced you.
Thanks, Jeff. I don't know what to say that's not totally redundant. As Jeff said, I am a county commissioner for the 9th District. I am chair of the Ways and Means Committee for Washtenaw County, and I also am a registered nurse who works in the ICU and have been following anxiously and interestedly the coronavirus since we first started hearing about it coming out of China in January. And my hackles were raised at that point, and many people told me I was crazy, that it was going to be fine. And I feel like here we are, and now with a pandemic on our hands. I'm really happy to be here tonight, though, to talk about some of your questions about what the state and the county are doing, and let's get to it.
Great. Well, we've had some questions coming in beforehand, but a couple more preambles. Right now in Michigan, we've got 80 confirmed cases statewide, 7 here in Washtenaw County.
That's right. I would anticipate that those cases will go up this evening when we have more tests come in. And we want to talk a little to you about testing, what to do if you're sick, because I know that is a huge question a lot of people have. We have not had an abundance of tests in the state of Michigan and also the entire country. So testing if you're sick, there are several health systems. Our St. Joe's partners and Michigan Medicine are both providing testing for their patients. I do not know how it is working through the IHA system, but for Michigan Medicine, it's a call ahead. You call a hotline. They will give you kind of a permission to test and a time for that drive-up testing. The public health department will have some testing available, and also several of the health systems are working on a rapid PCR or polymerase PCR testing, polymerase chain testing that will get testing done much more quickly for people. So if you are thinking about having a test, indicating, we're too far from the micro, we have to get closer.
Or we can speak up, and these are theater voices.
Theater voices. So if you are feeling like you are worried about testing, check your symptoms. So you're going to look for a dry cough, sometimes a sore throat, and a fever. Those are things that would make you think maybe you were positive for COVID. I would say that if you experience something like shortness of breath, that's a sign that it might be advancing. That's when I would think strongly about testing. If you had a fever and the dry cough, my advice would probably be that you should presume positive at this point and do what you can to self-isolate and quarantine yourself.
Yeah, thank you. And I think that highlights that this is an evolving situation. We put some of the resources behind us here so that you can go to the Washtenaw County Public Health website or the state's coronavirus website or the CDC's website. They're constantly being updated with new recommendations around social distancing, around testing protocols, and a variety of other responses that the state and federal government are engaging in. At the state level, I think some of the important things to mention right off the start is that my office is still open for business. I have Brad O'Feary to thank for helping to set this up, and Back Office Studios to thank for hosting this particular event. But we're still operating out of our office in Lansing, albeit virtually. So if you've got problems with state government, problems navigating the bureaucracy, questions that you think we might be able to answer, please feel free to communicate with our office by phone or by email, and we'll do our best to get back to you. I think it's also important that folks continue to follow us on social media. I'm constantly trying to put out new resources, sorry, we're trying to get the microphone right. Constantly trying to put out updated resources for folks to share information about what's happening. So the big things that happened at the state level are that the governor has implemented a number of executive orders, taken, I think it's fair to say, really strong action to try to flatten the curve on the spread of coronavirus, and closing down the schools, closing down restaurants. This was dramatic action that came out of executive order. I think it's also important to mention that as soon as that happened, certainly in our office and probably in the other offices around the state, a lot of the state legislators were getting questions from people about what are we going to do about what are we going to do about employment and rent, and what about evictions, and what about utility shutoffs. So I think it's important to say that right out of the gate, the governor has taken action on some of these issues. One, she did apply the state for the Small Business Administration loans. We're going to put information for that on the site again. She also extended unemployment, extended an additional 6 weeks, and also extended the eligibility to everybody who is affected, who's having a layoff or a temporary loss of employment due to coronavirus. And that's not going to make everybody whole, but I think that it was swift action that we needed that is going to at least backstop a whole lot of folks. Of course, I think the question that I know I've got in my stack of questions here that this begs is, what about folks who aren't eligible for unemployment? What about folks who are gig workers, folks who are small business owners, sole proprietors, folks who work in arts and entertainment and events? I think the straight answer right now is that we don't have good answers on that. We all know that there is an active discussion in DC right now. Just today, the Senate passed the paid sick leave bill that's going to extend more paid sick leave to a segment of employees. But yeah, I think we need some sort of federal action to make sure that folks who are going without income for a long period of time are still able to stay in their homes and feed their families. Another action that's taken place in Lansing, I think it's important just to get on the table before we go into all the questions, is that the state legislature has taken action. Initially, we appropriated $25 million to populate the State Department of Health and Human Services coronavirus response and the public health response to coronavirus. It became quickly obvious that that was not going to be enough. And so just yesterday, we met and increased that appropriation by $125 million. So now the state legislature has authorized $150 million in spending on coronavirus. About $50 million of that is going to be going to increasing the capacity of the healthcare system here in Michigan. On the medical side, $35 million of that is going into an emergency relief fund that we've basically given the governor some funds to use on an emergency basis to solve the problems that we anticipate popping up, and another $40 million to beef up the public health response here in the state of Michigan. So that's a kind of high-level survey of a lot of the things that have happened at the state level and what's been going on at the county level.
Those things really mirror a lot of the things happening at the county level. I think right away we recognized that this was going to be really serious. I am very proud of the response of the county that we've had so far. It's been a very fluid and evolving response. Today we had a brief meeting. We moved our meeting time to the morning. We had a brief meeting, and the chair of our committee, or chair of our Board of Commissioners, Jason Morgan, declared a state of emergency for Washtenaw County. And that will really just help us formally activate those channels between our committee in different coordinated actions happening, and leaves a lot of guidance to be given to us by Jimena Loveluck, who's the director of the Washtenaw County Public Health Department, who's been doing an outstanding job so far. I'm also, one of the first early things that happened is something you talked about with our courts and people who were very worried about what was going to happen to them if they were out of work and they weren't able to pay their rent. So I know that 14A, 14B, and the 15th District Courts, under the leadership of our Chief Justice, Carol Kuhnke, has said that they'll have a moratorium on evictions, at least until April 6th, which doesn't mean that you don't have to pay rent, but it means if you were in danger of that happening, there'll be a moratorium on that point. If you need more information about that, I'm happy to send out information to you also on how you can get the number to call for help with that. It means your landlord shouldn't be doing other things to evict you if they can't do it through the court. So if they're shutting off your water and your utilities, the county has a lot of resources for you to be able to do that. And like Jeff said, his office is open. I don't have an office with staff. I just have me, but I know that every one of my commissioners on the board is also very willing to help and try to get you to people that you need to get to for help. That's really important. And if you need to get to our statewide officials like Senator Irwin, we can help you get that contact in too. So some things are going to shut down in the middle of COVID-19, and that's a good thing, but some things will stay open, like your government officials, your elected officials. We're still going to be working for you, and obviously your nurses will too.
Yeah, I've had a lot of good conversations with other elected officials around the county, and I can say, everybody who I've been speaking with seems to be, rolling up their sleeves and trying to contribute. I've also had a lot of conversations with community members who are asking for ways they could help, and on the Facebook site, we've directed people to assist volunteer with the school lunch programs and with food gatherers. And there's a lot of organizations and individuals who are stepping up. I know that there are folks on Facebook who've organized a mutual aid group. And so I just really want to congratulate a lot of the folks in the community who've been stepping up and saying, how can I help? How can I reach out to a neighbor or to a friend, or what can I do to volunteer? Another important issue at the state level that I neglected to mention when I was talking about the budget and what we did yesterday is that the state legislature does have to take action to try to, but to give clarity to our schools and our families and everybody who works in the school environment in terms of what's going to happen with the school year.
Yeah.
We've got statutorily required testing coming up. We've got questions about whether or not schools are going to be able to pay all their employees, particularly their hourly employees.
That's right.
And then we've got another big question, which is state law currently requires 180 days of instruction. And if there is a large period of time where schools are out because of this public health emergency, parents and teachers and educators and administrators and everybody who works in the school environment are sort of wondering, what about these restrictions? So I want to let you know that just yesterday in the legislature, we were talking about this, and Democrats in general, I don't want to speak for others, but certainly myself, I'm fighting along with, from what I can tell, all my Democratic friends who are trying to say we need to make sure that all school employees are paid.
Yes.
We need to relax the testing requirements this year, because the time that the testing was supposed to take place is going to be time when the kids are out of school. And if we're able to have any more school this year, I don't think it should be all dedicated to trying to cram kids into computer labs for testing.
Absolutely.
And the third piece are the days. I don't think we should be extending school into July. That doesn't make any sense to me. This is, exigent circumstances, and I think that the legislature needs to act and provide clarity to the whole state community in this regard. I've heard from a lot of folks, particularly folks who are educators, who are concerned about this. Folks are absolutely right to be concerned about it. I share your concern. I do have hopefulness, though, from being in the legislature all day yesterday. Ultimately, the Republicans weren't willing to bring forward a bill to solve these problems, but I do think that there's willingness on the other side. And what I heard from Republican colleagues yesterday was, we're going to be back next week. Let's see how this develops over the course of a week. This is a fast-moving situation. Things are changing every day. I didn't agree with that conclusion, but it gave me a sense that the outcome that we're likely to get to on these concerns is a good one. I'm most worried about trying to make sure that we ensure that everybody who is working in the school environment can rely on a paycheck. I think that's the element I'm most worried about out of those three.
Yeah, I think that's important, making sure that people are getting those paychecks. And then I know that that we've had offers from different of the broadband providers to try to get people who don't have internet in their homes to get that for kids who need to go to school. And I think you're right. This is really an extraordinary circumstance. So whatever we do in this circumstance is not the new normal. And people, I think, are worried like they're going to make a decision and it's going to be like a decision that impacts everything going forward. These are emergency decisions we're making to protect our community and to make sure that we can all stand strong together.
Yeah, I mean, it's such an emergency situation that you've got Mitt Romney pulling out Andrew Yang ideas for Congress. So
That's right.
It's pretty amazing. I also want to mention we've gotten questions about public transit. The RIDE has announced that rides are going to be free. There's going to be more detailed information about that we're going to post after we're done with the town hall. DTE and consumers. Certainly DTE is more relevant to the folks here in the 18th district, but I think credit is due to both the public utilities who've said that they're going to end shutdowns during this period.
The water people,
correct.
And people whose water has previously been shut off, making sure that water comes back on in their homes.
Yep, that's absolutely right. And certainly folks stepping up in terms of the school lunches. And so, there's a lot of opportunities for folks who want to help to contribute to the school lunches. There are distribution sites all over the community, and we'll post that detailed information. One of the questions that we got so far is, I'm concerned about the shortage of food at grocery stores. I was not able to stockpile. So I hope that Commissioner Scott has something to add on this, but I can certainly understand that. One of the things that was somewhat surprising to me, traveling to the grocery store to, buy some food over the course of the last few days, was just, the psychological feeling it gives you when you walk into the store and you see a counter that usually has an impossibly large amount of meat on it, just completely devoid of any meat.
Yeah.
Right? So something like that is I think has a psychological impact on you. It makes you think, oh no, is this going to be what the new normal? Is this what it's going to be like going forward? I don't have any promises for anybody. I certainly don't want to give false promises, but everything I have heard is that the supply chain for food and groceries is not interrupted in any serious way at this point, and that that has been backed up by the fact that when I was able to go to the supermarket last night after I got home from Lansing at like 11:30 or something, there were tons of employees restocking shelves, and there was tons of pallets of stuff coming in. So I think near term, it's not something I'm particularly concerned about, but I do think that one of the things that is concerning is that there are folks who are hoarding certain items, and I give the Attorney General credit for trying to take action against that, but also particularly against some of the gouging that people have identified out in the community. We just introduced legislation yesterday, led by Senator Moss, I believe it was, to prevent the gouging.
Yeah, and I mean, I'm hopeful that people will see that stores are continuing to get replenished with goods, and so it's not a matter of the fact that these things aren't ever going to be able to be in a store again. The issue with sometimes people aren't able to stockpile because of the time. I know I talked to some colleagues who were like, I've just been working and I haven't had time to go to the store. But some people aren't able to stockpile from an income position alone. Yep. They don't have the money to stockpile goods when they're all in the store. So I think there's a community mindedness of taking what you need if you need to be quarantined for 2 weeks to keep yourself and your family going, and not taking those resources from other people. Right now, those supply chains are working. We have seen evidence of that, and we just need to take a deep breath and count on those things continuing to be in place.
Yeah, absolutely.
We answered, there was a question about confirmed cases in Washtenaw County. We did note that there were 7 at this time. That means that there are 7. So I'm going to clarify that. That means there are 7 Washtenaw County residents who have been diagnosed with COVID-19. That does not mean there are only 7 cases in Washtenaw County. We might have more because there might be more people in our health system. But 7 Washtenaw County residents have been confirmed. We had a question about our capacity for treating those cases in Washtenaw County. I know that Michigan Medicine recently announced a new 32-bed isolation unit, and they're calling it the RICU, the RICU. We all thought it was respiratory ICU, but it's a regional infection containment unit. So those 32 beds are dedicated specifically for COVID-19 patients, and they have indicated that they do not anticipate a bed shortage or a ventilator shortage at this time. I'm talking very fast is what Brad is telling me. I want to get to all the questions. I know there's so many burning questions. The cases that have happened in Washtenaw County most of them have a history of international and domestic travel. So that's where most of those cases have come from. Some have had contact with somebody else with COVID-19, and others have had no known contact or history of travel. So just the way we're seeing it play out every place else in the United States. But most of the cases in Washtenaw County have a history of international or domestic travel, which is another really good reason to not be tempted by the cheap flights and stay where you are and stay and shelter in your homes and flatten that curve.
Yeah, and that's comforting information to hear, from the health systems. But of course, as you mentioned, this all relies on whether or not we're successful in flattening that curve. Right. If the cases, perhaps our testing regime, and we know our testing regime isn't very good, and so perhaps we're going to learn soon that because of the holes in our testing regime, we didn't realize how far it had gone. I'm happy that the health system is taking steps and that they feel prepared, and it seems like they're maybe better prepared here in our area than anywhere else. But I'm also worried that so much has changed so quickly
Yeah.
on this coronavirus piece. And, if our efforts to flatten the curve are unsuccessful, well, I think that could change. So, that's another reason to remind people to be successful with your social distancing.
Yes.
I also think that sometimes, people should be thinking about social media distancing.
What do you mean by that?
That was my joke.
Oh, okay. Uh-huh.
I'm trying.
We're trying to create a little levity for you.
All right, so next question I have is what happens to hourly and freelance workers? I already talked about that a little bit. I don't think we have good answers for that right now. The social safety net here in the United States, I don't think I have to tell people we've been cutting holes in it for decades. And, we have an embarrassing social safety net, and it's not set up to support people when there's a bump in the road, which is crazy considering the fact that we know 40% of Americans can't sustain a $400 emergency.
Mm-hmm.
This coronavirus and the associated economic slowdown related to shutting things down, is going to definitely create more than a $400 economic bump in the road for millions of people.
That's right.
And so, hopefully this crisis is something that gives us an opportunity to long-term rebuild our social safety net because people need support. And right now, I think that's it's the freelance workers who are the most left out right now. I also think about folks who are working in daycare settings. I don't think that we've come up with very good answers yet about what we're doing for childcare, both in terms of the childcare settings and the workers, but also in terms of the families who need childcare because their employment doesn't allow them to be home with their kids during this period, right? And so it's a time to say hats off to all the healthcare workers who.
Well, yeah, and I want to add to your people that are at risk here too. I've heard from several constituents who work in retail that they don't typically have a long paid sick leave. And so they're shutting down and they don't have paid sick leave and they have all the same bills. And another group that's really at risk here is home healthcare workers. They don't have the same protections that healthcare workers in the hospital have. And so a lot of times they're going into people's homes without the protections of having any kind of masks or foreknowledge of what's happening with those patients. And they are also another group of people who are working for very low wages without paid sick time. So we rely so much in this economy on people who don't have those benefits and who then also, I want to point out, when they lose that job because either the place that they're working is shutting down or the place that they're working for says, we can't employ you anymore, that's a point where they don't have health benefits anymore either. And so that's another thing we're really going to have to start paying attention to after this crisis is done, or maybe even during how we're doing healthcare in this country and making sure that everybody can continue to have access, because for somebody not to have access right now in the middle of a pandemic is really a moral travesty.
Yeah, that's absolutely right. And just to put a finer point on the topic you just brought up, these home help aides and home healthcare workers are, they're providing critical care for people in our state, and we don't show that we care about them with the way we pay them. So just to give you an example of how serious that issue is, there are about 150,000, I think it's 136,000 home healthcare workers in the state of Michigan who are going into people's homes, providing intimate care, and they're making an average of $11 an hour.
That's right.
And so those folks were already stretched to the brink and pushed to the edge economically, and this. This is going to create great hardship for those folks and the people that they serve.
Yeah.
So that's. Hopefully we'll have better answers for some of those questions soon. Next question I have is, what is happening with the homeless shelters in Washtenaw County? Are they closed? So the homeless shelter is the Delana Center, run by the Shelter Association of Washtenaw County, is not closed. They are. My notes here say they're no longer accepting drop-off donations, but if folks want to help with the Shelter Association, they should make a monetary donation at AnnArborShelter.org. The Shelter Association is just continuing to monitor the situation, work with DHHS, watch their residents closely, but they are still open.
They're still open, and it's something we're talking about Also, we had some discussion about that at the county today too, because with things like closing the libraries, we know that there was a significant portion of the homeless population who would use the library to go and like wash their hands even, and they don't have those resources now. So we're trying to think about what we can do to help make sure that we continue to have resources like that available for the homeless in our county. I have a question that just came up about why social distancing is important. And this goes to the idea of flattening the curve, which is really not a joke. I can't even emphasize this enough, especially I'll call on my background here as an ICU nurse. We have very limited ICU beds in this country, this county included. The ICU beds will quickly become full. Like the best analogy I saw for it was when they talked about, the rush everybody had for toilet paper, and then there's no toilet paper left on the shelf. If we don't do the social distancing, that same rush will happen on ICU beds. And there's nothing you can do then to create another ICU bed. We have a limited amount of beds and workers who can take care of those patients. We have a limited amount of ventilators to take care of those patients. So you want to maintain the social distancing so you can flatten that curve to not overwhelm the healthcare system. This disease has a very significant, what we call an R0, a very significant how many people it infects per person. So on average, the last statistic I read was 2.6. So for every one person can infect approximately 2.6 more people. And that's in an average situation. If you are closer with people, that's going to infect more people. And if you do the social distancing and you stay apart, you are not going to infect as many people. Social distancing is one of the most important things that we can do right now. I cannot emphasize it enough.
Thank you. So has unemployment been extended to servers or tipped employees? Yes, I mean, for servers, certainly. Basically, if you've been paying into unemployment insurance, then the new order allows you to draw from it. I think it's also important to mention that the governor's order has something important for employers too, which is that when you're paying your unemployment insurance rate as an employer to cover your employees, if you have a lot of claims, that can go up in the future. So one of the things the governor has said is that these COVID-19 related unemployment claims are not going to affect employers' future rates, which is particularly important to business and small business. A lot of small businesses here in our area, in our county, are in this sort of area of employment and business. And so this is going to be very, very important. So yes, if you're paying into the system, you can draw out of it. And also, yeah, we've also got the website for the Unemployment Insurance Agency up here, michigan.gov/LEO/UIA. And you can also call our office if you haven't got questions about unemployment. We posted the number also on my Facebook page. I think it was yesterday or the day before. So if you have any trouble finding that stuff, let us know. Can online teaching replace face-to-face requirements? Well, that's a big question because, replace is a big word, right? So I think that in the short term, I think the answer has to be yes. I think that the districts who are doing and the educators who are doing the best job with this are doing everything they can to reach out to their students online and provide educational resources to them. That can be everything from actually doing something like this Facebook Live online, or doing a YouTube channel, or doing any number of other things like that. Or it could be just connecting children and families with resources, with exercises, with worksheets, with all sorts of different tools that they can use at home to continue their education while this is gone. Can it replace face-to-face requirements? I don't think so. I think school is a lot about socialization. I think that face-to-face is important. So I guess my answer is no. But in the short term, I think it has to. And I think that there are a lot of things that we need to get better at in terms of making our online education efforts more engaging, more successful. And so we're struggling with that. I think also, at home, trying to figure out some good resources to engage our children with. But we've also gotten a lot of help from our teachers at our district. And so it's something to, I think about going forward for the state. How can the state legislature be a part of support and providing backup to educators who are trying to carry through with their mission even during this shutdown.
That's right. I have 3 questions on one card here. One, I think this question, how are state and county coordinating? I think we've covered that question to some degree. The state is really providing a lot more resources to flow through the county to help us out with those things. And we, any questions that we've had as a county about how we are working with government have been very readily answered by the state, both by our elected officials in this area and the governor. Today we had a question about our Open Meetings Act, and I know that there is some worry about continuing to have meetings, which of course we need to do. We need to keep the business of the county going. So we did have clarification today that we can have these meetings remotely. I was very clear when I said this is great, we need to do it, but we need to make sure that we're doing it live so that people can continue to watch and ask questions of us and make comments to us. That is a very integral part of our meetings. And so I'm sure that we will be thinking about how we're going to do that to continue to engage our electorate going forward.
Let me jump in on that real quick. How are the state and county coordinating? The county is really an administrative arm of the state. It has its own elected leadership, and it's not quite as simple as just one being a vassal to the other. It's more complicated than that. But ultimately, when I talked earlier about those resources that the state legislature was providing to the Department of Health and Human Services and to the public health effort here in the state of Michigan, a lot of those resources end up flowing down to the counties, because the counties are how the state gets a lot of its most important work done. Everything to do with mental health and public health and human services. The counties are really the arm of the state in getting all of that done. So that partnership is essential for the state to get any of its work done.
The next question on my card is, what is being done to protect healthcare workers? I think that's really depends on where you are to protecting healthcare workers, but I know that the hospital systems in this area are thinking about what they can do to protect, especially emergency department, nurses, doctors, techs, cleaners, people down there, because they're really on the front lines. And I have to have a handout to everybody who's working in emergency, including the people who are out on the road too. So paramedics, fire, and police. I know that when you have a presumed case, those nurses are wearing surgical masks. When you have a case that is known, people will wear the N95 respirator, or they'll wear a big hood. The hospitals are thinking very much about how we use those things effectively going forward. And some of the best protections, I would be remiss if I didn't say it, to help protect healthcare workers are coming from healthcare workers who are organized. So unions are really doing a lot to help protect those healthcare workers. And unions are also trying to protect workers in other situations too. So I know people who are working in the big automotive plants, those unions are really working to try to protect them. I just want to review the idea about testing again in that instance. So I know healthcare workers are talking about how they will be tested if they are in contact with a patient who is a known COVID patient. Those healthcare workers will be tested, and they will also be placed on quarantine for 2 weeks until they know that they're clear. Healthcare workers who've traveled abroad are placed on quarantine for 2 weeks. And so it's really, if you feel like you want to get tested, you should call your healthcare provider ahead of time, because there's a huge backlog. We don't want people just going to the ER to get these tests. Call your healthcare provider, call one of the hotlines that is available to talk about your symptoms, and they will help you gauge, like triage, whether you need to have that test at that time or not. Again, as I said before, I think if you are having a dry cough and a fever, you should presume yourself positive and take the necessary steps you need to have self-isolation at that point. If there's a point where you start feeling short of breath, or like there's an elephant sitting on your chest, that's a time to ramp up and try to get in a little bit more quickly. I have what is being done to assist those not coping well with this situation. I don't have a great answer to that right now, quite frankly. I think one of the things I've seen through on social media is that there are a lot of people trying to come together to even connect with each other that way. Some neighborhoods are having things where they're saying, like, everybody just come out of your house on your porch at 6:30 to wave to each other. So we know that we're not alone. I think that making sure that we're taking care of each other and being gentle with each other is probably the best thing. But I'm sure that the person who asked this question was looking for something more concrete. So if you want to reach out to me, I can try to find more resources for you on that.
I think part of the thing is that we're still figuring out some of the answers to some of these questions. Right. And I think this is one of those there, what is the mental health impact of this? And what is the state and the county, what are the state and the county going to be doing to address that? We've had some constituent calls into the office about specific situations, and we're trying to work those through with the department and take those seriously on an individual basis. There are going to be some people in our community who are affected very acutely by this, and some of those are going to be folks who are already struggling with their mental health before all this started. So a question I have here is the governor considering a shelter-in-place order? I don't know for sure. Obviously, I haven't had that conversation with the governor, but I feel pretty confident in saying that based on the very aggressive action that she's taken so far and all of her executive orders, of which there have been several, and I think she's taken swift and strong action. And so I feel pretty confident in saying that everything's on the table for the governor right now, and I think that she is really, just working her butt off, trying to find every possible lever that she can pull that could help people here in Michigan that are struggling, or that we're worried are going to be struggling soon as a result of either the healthcare crisis or the economic damage caused by shutting things down. So is she considering it? I'm pretty sure she is. Although, so far it seems that the places that have used that particular tactic have been places with very, very high population density, right? So I know that New York City is there. I don't know for sure that this is a serious consideration, but I am pretty certain that everything's on the table. I think that what we're going to have to do is we're going to have to watch whether and how the sort of efforts that have been engaged in so far, social distancing and shutting down public places, whether that sort of works to limit the number of new cases and to have the healthcare system not be overwhelmed. And I think if it continues to be a situation where the healthcare system feels that they can handle it, that she probably won't. But I don't really know. I think it's a great question. Although, like I said, I feel pretty confident in saying that she's been pretty aggressive so far, and I'm sure this is on the list.
I love that you can have confidence in saying everything's on the table, because everything needs to be on the table right now. That's just where we are. Like, you can't say we're definitely not going to consider anything at this point because we just don't know enough about what's coming down the pike. One of the questions we just got online was, are blood donations needed? The answer is yes. 100%. There is an extreme shortage right now of blood, and the number of things that we use blood for every day in the hospital is enormous. And it doesn't just have to do with what's happening with COVID-19. Even though it is on the forefront of all of our minds, every day other things are happening and will continue to happen. There will continue to be accidents that happen where trauma, where people need blood. There will continue to be surgeries that are emergent where people need blood. And there will continue to be more COVID cases coming in where blood will be needed to treat some of those people. So absolutely, blood donations are needed. If you can donate blood, you should do it. You should donate at American Red Cross, and do it soon. Thank you.
A couple questions. One, can the state implement interstate travel restrictions? No, I don't think so, since it's interstate. But I do think that one of the things that happened today was that the federal government announced that they were closing the border with Canada, and I haven't had a chance to wrap my head around all the details with that yet. I think it's very similar to the travel ban with Europe, where it doesn't affect U.S. nationals or the transport of goods, but it does affect any sort of international travel across our international border just to our east. So also I got a question from Joanne from West Willow, was concerned about how this affects the economy and the community. What can we do? Hello, Joanne. Good to hear from you. Thanks for watching. So I'm right there with you. I am super concerned about this. And I know that when the announcement came down on Monday about the shutdown of public spaces, including restaurants and bars and a number of other settings, the first thing I thought about was, oh gosh, what about all the folks who work in all those settings and all the folks who own those small businesses, and what is that going to do to our community here economically over the course of the next couple of months? And so I'm similarly really concerned. I don't feel like I have great answers to this question, but I will say that I was very happy when, on the heels of that announcement with the shutdown, there was a quick announcement around the greater availability of unemployment, the greater eligibility for unemployment. Like I said at the very, very beginning, I know that doesn't make people whole, but it certainly can take the edge off of folks who I think were facing a much more dramatic situation without that small amount of help. I think that we also are hearing some positive noise out of Washington, D.C. I don't want to get overly political here, but to get a little bit political, I think that it's fair to say that the federal response has been slow and insufficient, both in terms of the response with healthcare and testing, but also on the economic side of this. And I think it's interesting that the president, who previously was hinting that this was some sort of, hoax, or that this was, going to blow over quickly when the weather changed, or there's all sorts of different kind of statements that I thought were nonsense. Now that there's some economic, damage that is becoming obvious in the markets, he seems to be taking it very, very seriously. And so I'm hopeful, frankly, that will cause some action in DC around something like they're talking about now. And while I know that we're going to hear about bailouts for airlines and a number of other industries, what I'm interested in hearing about, and what I'm hopeful to hear out of Washington, D.C., is a bailout for people like we're concerned about, Joanne, people who, are working folks who, are paying their note and all of that, but now they've been upended by this crisis. And what are we going to do to help them? When do those folks get a bailout? So, frankly, I've been happy that some of the ideas that have been out there just to provide some resources to people who need it are catching fire.
Yeah, I think that's right. To talk about our community and think about that. Like Jeff, I don't really know what to tell you what we can do, but I think that thinking about supporting our local economies is probably a good place to start. And what's really unfortunate, I feel like what we were seeing before this was just after that last major turn down, we were finally getting to a place, I feel like, where people who were hardest hit on that were maybe feeling like things were coming around a little bit, just a little bit. And now we're all pushed back again. So hopefully the national government, the federal government, will figure out some of these things to help people more than they're figuring out how to help giant corporations. Not that we don't need to help them too. I'm not saying that, but we also need to keep considering thinking about the people. I'm saying you have to help the corporations sometimes because that's where people are working, but focus on the people. That's a very confused answer that I gave. I have a question on, should people who are 70 years old with a heart condition go to the eye doctor, or should they go to the hospital for an elective MRI test? I will not feel comfortable telling you any of those things without knowing your health condition and your history to begin with. So the best answer here is consult with your healthcare provider and your eye doctor before the appointment. Tell them what's going on, and they will give you the best advice. The CDC does suggest that people who are at higher risk should stay home and avoid contact with others. I think every healthcare provider is going to tell you that. And so make sure you contact the person who knows your history to give you the best advice. If you have a condition like a heart disease or some kind of lung disease, diabetes, and you're over 70, the best advice is to stay at home as much as possible.
So one of the things I've heard about from a couple of constituents I just wanted to mention here are the uptick in scams. People over the phone, usually over the internet, trying to use this crisis to advance some sort of financial scam. Usually, I would encourage folks when they encounter that kind of situation to report those situations to the state attorney general. Our attorney general, Dan Nessel, takes things very seriously, and she will, I think, follow up on these concerns. And I would also just encourage folks to remember that if you didn't seek out a service, you don't give out any personal information. You're right. There's no reason to ever give anybody any personal information if you didn't call them. That's a good rule to follow. One of the other questions we got here is, why can't Washtenaw prepare field hospitals? I'm not sure that we can't. And I do think that Commissioner Scott mentioned that the University of Michigan Medicine was setting up a RICU, regional
Regional Infection Containment Unit.
Exactly, which I think is actually kind of like a field hospital, right? I mean,
Well, it's in the hospital. I think when people are talking about field hospitals, they're talking about like legitimate
right, it's gonna be in the
field hospital,
Yeah, good
in the
point.
field. One of the answers to that is that you can't just set up a field hospital without having a certificate of need from the state. So that will be something that county governments and state governments are working together along with the government and setting up more hospital beds. Anytime a hospital wants to increase the number of beds, they have to talk about that. And also hospitals and counties have plans in place for emergencies. So we have a local planning committee that talks about how we will set up shelters, that we will set up systems in different places we have contracts with already, whether those are schools or faith centers, to set up surfaces that we can provide for people there. And so all of those things are things that certain criteria are met and those things tick into action. So at some point that could happen, but there are definitely, we can't just do it. You have to have that certificate of need and you have to meet certain criteria. So it's not saying that it won't happen, but that's why we haven't done it yet.
And one thing I'll add to that is that I believe it was yesterday, the governor issued an executive order on to the Department of Licensing and Regulatory Affairs, directing them to streamline bureaucratic barriers to the expansion of healthcare capacity in
That's
Michigan.
Right. Yep.
I don't know what all of the implications of that are, but I'm assuming that when it comes to things like setting up more bed capacity for something like this, that would be covered. And I'm also assuming that there are some healthcare licensure issues that can sometimes be a bureaucratic snag for folks who are trying
Right.
to provide care. Her executive order was meant to, I think, smooth those regulatory barriers out. I think the details of how that executive order is going to be carried out still haven't completely washed over us yet because it was just yesterday.
Right.
But I do think that that consideration of setting up more capacity was part of what was embedded in that executive order to try to get rid of some of those regulations.
Also, Governor Whitmer has activated the Michigan National Guard to help deliver supplies to local health departments. So we're definitely thinking ahead of time on how we're continuing to get those supplies out into our community.
Right, folks, I know I've heard from folks who are struggling to find testing kits or get tested. I know there are healthcare providers that are struggling to get those kits, but we've also heard about shortages around masks and other necessary healthcare items that are necessary for the protection of healthcare workers. That are necessary to reduce the spread of the infection. And it's great that the governor is using some of those resources that the legislature appropriated that I mentioned earlier and the National Guard to make sure that those supplies get where they need to get. Hopefully that will happen quickly.
I have a question. How long does the virus live on surfaces? So this is a new virus. And scientists are really finding out new things every day about the virus. A recent study of COVID-19 suggests that it can live in the air for 2 to 3 hours, on cardboard for about 24 hours, on plastic and metal for 24 hours. So that's why all of the best advice comes back to wash your hands frequently with soap and water for at least 20 seconds. If you do not have access to soap and water, use the hand sanitizer nearest to you often. Don't touch your face. I do it probably 50 times an hour, and you should practice all that social distancing to try to keep away from that virus lingering in the air for 2 to 3 hours.
I think I have touched my face 3 times during this.
I know. Somebody could probably keep count for us.
Every time I do it, I think, oh, you're not supposed to be doing
immediately that. When I say don't touch your face, my eye itches. So, but healthcare workers, my nurses out there will know this. We'll go into rooms. Already we take care of patients who you have to go into rooms with protection on. And we joke about it. The minute you go into, you gown up and you put your mask on, your eye protection, the minute you go into that room, something on your face itches. It's just Murphy's Law. So.
Yes, one of the great laws of life. So What can we
Irishman.
do to support small retail businesses? This is a great question. I think it also touches back on the question from Joanne about, what are we doing about the local economy? I think that we need more answers from government, and it's just my job to help provide more of those answers going forward. But I also think there are things that we can be doing locally as community members. And we talked earlier on about people helping people and reaching out for your neighbors. I think that the part of the answer to what we can do to support small retail businesses is in the same vein. There's a lot of great small businesses locally who are they're wondering whether they can stay open, right? They're wondering whether they can continue to serve food, for instance. And I think making an order for carry out or something like that is one of the ways that you can support that. If you've got a local restaurant down the street or in the neighborhood that you want to be there in the future, well, support that business. Make sure you send them some business. Make sure you tip your delivery person well.
Yeah.
So I think that's part of what we can do is just try to help support these small retail businesses. If it's not a food service business, I think reaching out to them to find out if there's any way that they're still in business, trying to give them business is what they need.
That's right. I think that's great advice.
I would also say just one more thing on that, which is that there are low interest and zero interest loans, I understand, available to small businesses. And the state of Michigan has now officially tapped into that federal opportunity. There's information already on my Facebook page from a couple days ago, but we'll post it again with our resources link after this is done for how you can get in touch with the Small Business Administration and try to get some of that financing that could help people stay afloat or could help people bootstrap themselves back into business, hopefully when folks are no longer barred from going out.
Yeah. Next question I have a question from Irwin, Washington. Hi, Irwin. She asks one question, I have no idea. She said, have I reviewed estimates on the fertility model out of Britain? I have not looked at those estimates in particular, but you can bet I will be going home to do so. And can I compare what is happening now in the United States to Italy and where are we headed? I have compared that. I have looked at that, and what is happening now in the United States is very similar, unfortunately, to what is happening in Italy. We are headed up that steep curve. That's a curve that is very common to people who study public health, and it's an epidemic curve that goes up like that because of the rates of infection to other people. We are following exactly on their path right now. This is, again, why I want to emphasize social distancing. That is the way to make that curve flatten out. It doesn't necessarily mean fewer people are going to get COVID-19. It means the curve of all of us getting it together won't happen. It will spread out over time. It will lessen the effect on the healthcare systems. It will improve the pressure that we have on the system. It will keep our healthcare workers that you're going to count on to treat you and be there for you. It will keep them healthier over time as well, because the more people that come in, the higher that virus load is on healthcare workers providing that care. And that's why you're seeing higher rates of infection among healthcare workers. One of the theories is that it's because those workers are exposed to higher levels of the virus, and that's why they get sick more often. So if we can flatten that curve, you're protecting your doctors, your nurses, your techs, you're protecting the people who clean your rooms, you're protecting everyone in the hospital, so we can continue to take care of you.
All right,
Next
a couple
question.
questions here.
Yeah.
Are dorms being considered as overflow medical attention spaces? Not that I'm aware of. I haven't heard that idea. This is the first I've heard of it. I do know that at the universities, the residence halls, university housing has communicated with students at the universities here, at least, to say that they're trying to reduce the number of dorms that they keep open. And so I think they're trying to consolidate all the students into, I don't know how many, one or two or just fewer facilities. Yeah. So those other facilities will be, more empty, but I don't think anyone's considered it for that. But I do think that
I don't think that they've considered it for overflow medical attention spaces, but I think there has been consideration about using dormitories as spaces for healthcare workers who might need to self-quarantine from their families. So once a healthcare worker is exposed to COVID-19 and doesn't want to go home to expose his or her family, who you might be living with children who are immune compromised, partners who are immune compromised, who might have parents living with them and don't want to continue to go back and forth to their homes. I think there has been some discussion about dormitories being used as a space where those medical workers could sleep in the time that we're going to be able to sleep.
Yeah, and it's a good question. It makes me think about other opportunities there. We have a ton of folks here in our community who are housing insecure or who are houseless because we have an affordable housing crisis in Washtenaw County. It's been going on for a long time and it's only gotten worse. And so there's a lot of folks who are living in rough situations and who, I think there's a really good public health case to make that making sure that they're in a house of some sort is as advantageous to us all. But this is the first I've really thought about dorm capacity, and obviously we'd have to engage the university and all the partners there.
That's right. Should I visit my elderly mom? Can I go to the dog park? Can dogs spread COVID-19? You probably should use circumspection and use in visiting your elderly mom. I don't want to tell anybody not to go visit their mom because moms always want to visit, but I think that it's possible right now that you should not, especially if you are not being careful with your social distancing, that you should call her on the phone every day and tell her you love her, but maybe not visit her. Can you go to the dog park? Yes. You can go to the dog park, but maintain distance between other people. There was some concern early in all of this that dogs could carry COVID-19. That looks like that is not true now. I think everybody by this point has seen the Facebook meme about the WHO, the WHO let the dogs out. Yeah, it's kind of funny, maybe. So no, dogs at this point cannot spread COVID-19. Let me tell you, everyone, Jeff Irwin is a hard audience to make laugh over here. Trying to make you laugh.
I was just thinking maybe that the dog transmission rumor was started by some cat people.
That's right.
Question. So yes. I don't want to put you on the spot here, and I don't know if you can answer this or not, but when we're thinking about, like, should I visit my elderly mom, for instance, is there, what do we know about the disease in terms of a period of time, right? And I know when this was kind of breaking, a lot of us were told, well, folks are going to quarantine or self-quarantine for 14 days to see if any symptoms arise. Is there any point at which, people who have been doing a good job of self-quarantining and staying out of social spaces could say, you know what, I haven't had symptoms in 2 weeks, 3 weeks, a month, is there a time horizon that people could sort of look at, like, maybe I shouldn't visit mom now, but in a week I can if I'm still not seeing any symptoms?
No.
I'm saying a big no.
No, I'm saying no, because I think in a week you're going to see even more cases. So maybe you haven't had symptoms in 14 days, but on your way to go over to meet your mom, you stop at the grocery store to pick her up some stuff. And while you're there, you come in contact. Remember what I said about that virus? The estimates now that it stays airborne for 2 to 3 hours, that you come into contact with that virus. It's not enough to make you sick. Your immune system fights it off. You're fine. But at that point, you're carrying it. And you could be shedding that virus and infecting somebody else whose immune system is a little weakened. And as we get older, our immune systems generally get weaker. So you might not get sick, but then you might be carrying that virus to your mom. So that's why you want to be very careful about that. Obviously, that's why we talked about, you want to go buy groceries for somebody, buy the groceries, leave them on the porch, and let them come out and get them later. So you're not doing that face-to-face potential for transmission there. That's the best advice I have to give to you. As for when we might see the end of this in general, I don't know the answer to that.
Yeah. This next question kind of is an opening
is
to
it?
that. So let me start it off, and then you can take us home.
Okay.
So what happens if the April 5th date is extended? Should that date be a defined date when this will be over? So first, what happens if the April 5th date is extended? Well, I think the same thing happens as is happening now. We're going to have to cope with it. We're going to continue to use platforms like this and email and through the office to try to inform people about what's going on, give people as much up-to-date information as we can so that folks feel connected. And, we're going to have to work through it together. Should that date be a defined date when this will be over? I don't think we get to choose that, really. I mean, I do think that at some level, the governor is responsible for choosing at which point some of the executive orders that she's laid out there are going to be lifted. But I do think that some of this, or most of this really, is more governed by the science of the virus coronavirus, the capacity of the healthcare system, and the development of the virus itself, or on the flip side, sort of our success in handling it. So, yeah, I don't think that that date will be a defined date when this will be over. And just to talk about it a little bit more, I mean, I actually think that if we are successful with flattening the curve, as has been mentioned a couple times, it's very unlikely that this will all be over on April 5th. It's much more likely that this will continue for longer.
Yeah.
Because once again, flattening the curve pushes that curve out for a longer time horizon. I think that is ultimately the best thing for public health, for keeping the most people alive, for minimizing the damage in terms of people's health with this coronavirus. But I don't think that it's going to be over at that point.
It's not going to be over by April 5th. I feel like I can say that unequivocally. It is not going to be over by April 5th. And, when you look at places where the virus has been, particularly if you want to talk about Wuhan, people in Wuhan are still under lockdown. They are not seeing an increase in cases right now, but they still have Wuhan people on lockdown. And that should tell us something about the time frame we're looking at here. You do not want to arbitrarily give this a date. I would love to think I'm in control of this, but I'm not. And neither is Jeff, and neither are any of us. And so we really just have to learn to be flexible in the face of this, and live with the uncertainty, and remember that we're doing what we're doing to protect our community as a whole. And that's why we're doing this.
Thank you. So this is a bit of a callback, but the question is, are conversations being had in Lansing on what actions might need to be taken with regard to school closures and the time being missed by kids? Is the legislature considering forgiving that time and shortening the school year? And what about relief for lower wage hourly workers in our public schools? Will there be relief? So those are really the questions that we're facing in the legislature with respect to school aid right now. And earlier in the recording, you can go back and watch it, but I'll try to recover it a bit here. I talked about this. So as I see it, there are three big pieces. There's the calendar, there's testing, and there's compensation. So what I'm fighting for in the legislature is to compensate all the school employees and make sure that they're paid this year, to relax the testing requirement before the end of the school year, that their time is not dominated by testing, and finally to relax the year this year. There's 180 days required of school in state law. We relaxed that last year for a couple days for some districts because of snow and inclement weather. I think this year we should be relaxing it for everyone because of this coronavirus shutdown. That's what we're fighting for. That's what I'm fighting for. I can tell you that Democrats were broadly organized behind those three goals in Lansing yesterday. We thought legislation was going to come forward to take care of that, to give our schools and families clarity, but it didn't happen. Ultimately, as I said earlier, I am hopeful that issue is going to be back on the table next Wednesday. We're having session again next Wednesday, and we've been told that that's going to be the heart of the agenda next Wednesday. So I'm hopeful that we'll get some of that done, but I think it's important that we actually get all three of those things done. So it's still at issue, and that's one of the reasons why I'll be going to Lansing next Wednesday.
Thanks, Jeff. This question looks like it could be for both of us. What will the two of you do to continue to support community mental health funding and unions during this period?
Do I go first? I've been talking. I'm happy to go first. So okay. What we do to continue to support community mental health funding and unions during this period. So as I said earlier, the state has been cutting holes in our social safety net for a long time. Yes. And I give a lot of credit to all my partners in local government, not just Commissioner Scott, but all of the other members of the county board, because they're the ones who have to deal with everything that flows downhill from the state, all the bad decisions we're making to withdraw investment from our public health system and to withdraw investment from our mental health system. This has been a 20 or 30-year trend that we're on the back end of now, and here this crisis hits us and we're very unprepared to deal with it. So I'm incredibly worried about how this crisis is going to affect families who are struggling in the mental health system that already is not at a level that can deal well and to give families the support that they need and deserve and that the community wants them to have. So it was already a tragic situation as far as I'm concerned before coronavirus hit. It's one of the reasons when I got to Lansing last spring, I requested to be on the Health and Human Services Subcommittee for Appropriations. It's one of the most important discussions happening in Lansing. What are we doing for people who are struggling with mental illness? What are we doing for people who are struggling with poverty?
Right.
These are questions that are right at the heart of why I'm involved in public service. So I'm super concerned about this. So we're going to continue to fight for increased funding. That's one of the reasons why we were in Lansing yesterday to appropriate some of those dollars that are going to flow through our county public health agencies. But we need to do a lot more on mental health. And, I'm going to be at the table throughout this budget process, fighting for more resources for our county mental health agency, for those direct care workers we talked about earlier, for, improving the quality and capacity in our drug treatment programs. So those are all very important to me. And, with respect to unions during this period, I thought Commissioner Scott spoke eloquently about the importance, the role that they're playing in the healthcare system, and that's something that comes to mind whenever I'm talking to healthcare professionals, especially nurses. Is what a difference it makes that we've got locally a unionized workplace in our healthcare system. I think that means the world in terms of the kind of quality of information we get, as well as the kind of quality of service we get out of the hospital. Other than that, I think that the state just has a role in funding public priorities in a way where the people who do that work can earn a living wage, and that happens in partnership with labor.
Yeah, I think that's right. And the funding that we have, as Jeff pointed out, not only community mental health funding has been gutted over the years, but so is public health funding also. And so that I know that is definitely a priority that I've had to talk about, how we get more funding into the system. And now we're going to see all of the reasons why that should continue to happen. So community mental health is public health, and public health funding needs to be increased. We were caught, as I said, we've been caught on the back foot. And so I will continue to advocate to my state legislators about getting that funding and how we can do this. In terms of supporting unions during this time period, that runs in my blood. I think that what we're seeing is that the unions are really people who are protected at work by collective bargaining agreements, are really coming out to talk about how the workers continue to be protected at work from COVID-19, whether you're a nurse or you're somebody who's working in the factory in one of the plants here in Southeast Michigan. Those unions are really working to try to give workers a voice, to try to talk about the protections that we need, to talk about how employers need to be responsible in taking care of the people working for them. And especially, I know for nurses, it's important for us. We want those protections so we can continue to take care of you. So I can't imagine that I'd see anybody come to me and tell me unions weren't necessary during this period. And if they did, I would fight that with every fiber of my being, because I know that those unions are existing to create workplace justice for thousands of people here in Washtenaw County, and we need them to continue to support our community.
Yeah, absolutely. All right, and I think we're gonna wrap up here. We had scheduled to go till 8, and I think it's a little bit after that if my eyesight is good. But we have one more question that's come in. How can our rights and civil liberties be protected during this outbreak? That's a great question. It's a great and challenging question, yep. And I think that this is a question that I think is going to become more important the longer this goes on.
That's right.
And I think that a lot of folks are tolerant and accepting of a temporary disruption in their lives for the interests of, the capacity of the healthcare system and the best interest of the community, and, try to keep people alive. I think everybody's ready to chip in for that. But I do think that, folks rightly value their civil liberties, and they should be expecting those of us who are in elected office to be keeping an eye out for that. One thing I'll focus on in this area is our voting rights.
That's right.
We saw what this did to the primary election in Ohio, or at least we the first shoe dropped that they delayed their election. I think it's important that we make sure that doesn't happen with our elections this November and this August. We've got plenty of time to prepare for those elections, and whether that means rolling out a more aggressive vote by mail program, or whether that means taking other measures to make sure that people have the time and availability to vote. I think that is incredibly important, and I think that the idea that anyone might try to use this crisis to divert or upend our normal democratic process would be important to me, and something that I would be quick to speak out against.
Yeah, I absolutely agree with you. This is not the first time that our country has faced a pandemic either. So everybody has been talking a lot about the 1918 influenza epidemic, which of course I've read books about because I'm totally a dork, but it didn't disrupt our government in that way. We also had a huge pandemic in 1889. Fewer people know about that, but our government continued in the face of wars at home, abroad. These things have happened, and like Senator Irwin, I really find that voting is going to be the thing we're going to need to be most vigilant about. I would be horrified that anybody could use this to say that we should delay votes. Our current Secretary of State, Jocelyn Benson, has made it easier than ever for people to get to the polls and vote. I am sure that she is coming up with plans for what we had to do in August and November should this continue that long. And I think we have to continue to be very vigilant about civil liberties and rights going forward. They are fundamental to who we are, and we have to be very clear if we see people infringing on other people's civil liberties to speak up, because we have that right in this country to speak up. And you have people who will support you if you speak up. Two of them are sitting right here. And so thank you for asking that very difficult question. Yep. And thank you for coming to our Facebook Live event.
Absolutely.
Stay away from other people. Wash your hands.
Yeah, absolutely. Yeah. And just one more thing on this last question. I think that making sure that our telecom system is open and free and fair is another thing that's really important.
Yeah.
And I'll just mention, I know we can count on our Congresswoman Debbie Dingell to be, active and to be aggressive and fighting for our rights in Washington, D.C. I think this is another area where, we need to make sure that federally we continue to have an open flow of information.
Yes.
And I've got concerns about the kind of information we're getting from the federal government. So it's even more important that we, make sure that our universities and our hospitals and the people who work in them and people who work in government, have an ability to speak out as well, because that free flow of information is one of the things that protects us. So sorry to drag us back to the conversation.
It's good.
Thank you for joining us. We're going to place more information on Facebook sites. Provide links to resources locally. I want to thank my partner here, Commissioner Scott. I want to thank Back Office Studios for hosting us, and I want to thank Brett O'Fury for helping support us through this. So thanks everybody for watching.
Thanks.